Okay, I assume you could all see my screen here. All right, great, success. For those of you who don't know me, Omar Nazir, one of the upper extremity surgeons, and I'm going to be talking about this pretty interesting topic, burnout in orthopedic surgery, or that was my initial idea, but really what we're also going to be trying to gear this more towards is resilience in orthopedic surgery. So briefly, how this came to be is I've done some work previously with the medical students and in regards to coaching and advising, etc. And eventually, one of the focuses that we developed was one about wellness and kind of things you could do to enhance your career, if you will, and the longevity and quality of it. So, in a similar sense, time passed, the curriculum at the medical school changed, and I transitioned into this role as a life and wellness advisor. And I it became more of an interest. And then, secondary to that, Dr. Freese asked me to consider doing a similar thing for the department, being a kind of director of wellness for us. And after some consideration, I ended up saying yes. And the reason there was some consideration involved was, fortunately, our residents and the medical students who come on service seem to have a good experience during the rotation, but and the residents during their time in residency are faculty at some of the lowest kind of wellness and satisfaction scores. So this is a pretty significant burden and a significant thing for us to deal with. And I think by taking a few little steps, hopefully we can address these things and make us all a little bit more resilient. I don't have the chat up here. I'm not technically savvy enough for that. So if you do have any questions or see something funny, please just speak up and kind of stop me at any time. So no real disclosures, but I think these are the disclosures to kind of focus on. So foremost, this is an interest of mine. I wouldn't say I'm a real expert. I've been doing some reading, and I have attended a few lectures and whatnot, but really, whenever you talk about wellness, I am cynical, just like most of you working in medicine as a surgeon, etc. But really, I think by embracing some of these things, it could be really beneficial. So please try to keep an open mind as I talk about these things. I know some of it sounds kind of hokey, but it really is something that's a big issue for us as surgeons. And I think deserves a lot of mental effort and time. And then lastly, there's a lot of different directions we can take with this. And I'm really looking forward to hearing feedback on this talk and even on ideas for the future. One of the things I have learned about wellness is the worst type of wellness is forced wellness. And if there's not a lot of interest in this, if you think time would be spent better otherwise, please let me know. Slide a note under my door, send me an email, or just on these comments that Robin solicits after this talk. Any information you could provide me in order to make this potentially better would be well appreciated. So just in kind of outline form, so my long-term vision for something like this is during this talk, you're going to get a few pieces of information, but really I want this to be kind of a diagnostic. So to see where you feel that you are in regards to wellness, and I'll present a few resources that are available. I'm about to start my seventh year practice here at OHSU, and I had no idea about most of these until just the last few months. And once again, at a later date, based on interest and kind of what everyone else is interested, there are a number of faculty resources, etc., resident resources that we can bring in to augment this kind of series. And then the last thing I kind of want to mention, I think this is what this picture I was trying to show illustrates here, is that oftentimes it feels like the institution's kind of beating up on you. And there's two major parts of wellness. So foremost, there's the individual wellness, sleep hygiene, exercise, et cetera, et cetera. But very important and equally, if not more important, is also the institutional aspect of it. So things like turnover time, adequate compensation, et cetera. And I'm not about to say that, one isn't as important as the other, but I'm saying that both of these should be a constant focus and something that when you do get surveys from the institution, et cetera, we need to mention that these issues that are occurring aren't just personal ones, but also institutional ones that if we address kind of as a group, we can hopefully have a bigger voice in addressing some of these challenges. Okay, and I can't go too far along without thanking these parties here in a couple of these papers. So this managing stress in the orthopedic family, I really used a lot of the information from this paper in this talk. So highly recommended. This may be the actual article for those of us who are taking your recertification for your boards or the maintenance of uh, certification. This article, I think it's actually in there. So one little point, just these folks that are pictured here in the top right, that's Dr. Mary Moffat, in the bottom left, that's Dr. Sydney I. And they are two of the faculty in the wellness kind of arena who are available. It's both faculty and residents for counseling and coaching who were very helpful for me in this talk. And then the bottom right there, that's Megan Fernari, and she's has a real big role at the medical school working with uh, medical students about resilience and wellness, as well as the residents. And finally, I stole a couple slides from this talk by Dr. Gabb here at Ohio State. Okay, so this is kind of going back to a few slides, and I think this is one of the most common things about wellness that's really challenging. So foremost, thinking this is silly and that, hey, I'm doing just fine. I have other priorities that are more important. And the other challenge is this kind of fourth line is that you don't know the struggles that I'm going through. And I know how to manage. I've made it this far along in my career. I'm successful, etc. But unfortunately, this is both kind of true and not true. So not true in the sense is that everybody is going through these struggles and has a lot more parallels to each other than you would think. And while each of our situations are unique, there's often more common variables that are shared than one would expect. And it kind of goes along these two theories that are seen in psychiatry, something I just learned about, this ego syntonic and ego dystonic. So what these words kind of mean is that my problems, it's either the fallacy that, hey, my problems are my own, nobody understands that, or I'm doing just fine and people I don't need these interventions. And what the data supports and what it shows is that really doesn't seem to be the case. So here's a little interactive portion. So everyone, please get your smartphone out or paper and pencil. And there's this survey I want everyone to take here. It's called this Moslock Burnout Inventory. And this is a validated survey that is able to kind of assess your level of burnout. So there's three little slides we'll go through. The important part here is this total score for each section. So I'm going to have an awkward minute or two here where I just stare at my computer screen. But while I'm doing this, I'll, like I said, 2 minutes. Please, I want everyone to go through this section and just note their total score. And like I said, I'll spend maybe 2 minutes per slide here so everyone has adequate time. So once again, just the total score, 0 through, what is this one? 0 through 6. Yep. I'll give everybody another 30 seconds here. Okay, so add up your numbers here, get your total score. Just like Natalie said for the last talk, math is important. Okay. Oh. Okay. So here's section B, here the next section. So once again, just get your total score, and I'll give it another, I guess 90 seconds seem to be adequate. So you can give it a good amount of thought here.
Omar, is it possible to fail this? I didn't study.
We'll get to that later. I think if you end up with a letter at the end, yes.
I got a J.
Okay, and then lastly is do section C. All right, another 30 seconds or so. Okay, super. So let us move on. So what does this stuff mean? Okay, so we'll kind of go through each of the sections and just see where your score kind of ended up. So the first section is checking burnout. We'll get to this in a second, but really, what this, I think the key point of this kind of slide in the burnout section and what's kind of unique to burnout is unlike depression, the problems disappear outside of work. Of course, there's some bleed through, but it's this section A, this first section about burnout, and you can see where your level is on this little chart. Next one is this depersonalization. And I think the way that I see this most commonly, and I think this kind of happens to all of us, is that instead of patients being patients, they turn into problems. So, oh, here's another distal radius fracture. Here's another IV drug user. You know, it's just getting this depersonalized aspect is something that we often see. And I think, you know, I've felt, and I'm sure many of you felt as well. And lastly, there's this personal achievement. And this is another interesting aspect of it. And this part of the feeling of burnout is something that really is a large contributor. And here you can see that one of the manifestations of this is the person you begin to kind of doubt your abilities. And what does this mean from a real practical sense? So burnout is three of these main areas, and just like sad baby Yoda maybe is feeling some of this. So emotional exhaustion, depersonalizations, decreased sense of personal accomplishment. So okay, you know, we're tough, ortho, we got this, you know, we're able to make it through thick or thin, but what are the manifestations of this? And so with early, nice, so early signs, um, you can often see is Baby Yoda. So early signs are a decrease in professional performance. So, your case is not going as well, patients, etc. Their morale can go down. And, depending where you are in your career, oftentimes people are looking up to you and that your morale affects the entire team. And there's also physical and somatic symptoms. So physical symptoms, one thing that I sometimes have is this little bit of an eyelid kind of twitch, and I'm sure many of us have these. Your neck hurts, tension, headaches. You can go on, and somatic symptoms as well, like GI distress, etc. And then there are these later signs. So self-medication. So we joke about these things. Oh, we need a drink after work, this and that. But at a certain point, many of these behaviors can become pathologic. And the serious self-doubt, like, oh, I can't do this anymore. So um, these are all things that I think we also need to kind of make sure that as peers, we're looking out for each other's avenues when we do identify these symptoms. And if that so this is, I think, another really important demonstration about how this can bleed into these aspects to really affect your clinical career. So this study looked at burnout and the percentage of surgeons with major errors. So surgeons with this high depersonalization, you can see their percentage of major medical errors is greater than 16%. So these things really do matter. I'm going to play a little recording here. So I'm not sure how many of you have heard about this in the news. This is from a few years ago, and I've never tried this through WebEx. So if somebody could please chat it up or something, if this actually comes through or not. And it's just a couple minutes, and this is a little bit of an extreme example, but just want to demonstrate what this can turn into.
Representative of most healthcare professionals.
Can everybody hear that?
Most people who get into medicine do so because they want to help people. They take a vow to uphold a standard, but occasionally that standard is violated. In 2013, for instance, a man went to have a colonoscopy at a medical facility in Reston, Virginia. There was the gastroenterologist who performed the procedure, an anesthesiologist, and a medical assistant. The patient planned to record the doctor's instructions on his phone once the colonoscopy was over, but he accidentally recorded the whole procedure, from his nervous questions before things got started. To the doctors talking about him once he was anesthetized. They start talking about an earlier problem the patient had, a genital rash.
He keeps mentioning it like it's the first time he's ever talked to anyone about it. I'm like, sir, he's a urologist. Well, what are you telling me for? And also, don't mention it to me. I'm not interested.
And I don't care, exactly. And then he went on and on about it, and I'm like,
One of the nice things about being a specialist, I don't deal with that.
being an anesthesiologist.
Why didn't you become a freaking urologist?
In case you didn't catch that, the anesthesiologist says, one of the nice things about being an anesthesiologist is making people shut the hell up. And then she continues, alternately talking to her colleagues and the anesthetized patient.
After 5 minutes of talking to you pre-op, I wanted to punch you in the face, fan you up a little bit. To just make sure you're yapped up. I want you to accidentally rub up against it. Syphilis on your arm or something. It's probably tuberculosis in the penis, so I think you'll be all right. PPD in like a month, and then you'll take some INH and get fine.
Well, it's not Ebola, you're.
So if you see a reaction, penis Ebola.
It's penis Ebola, she says, which is not the thing. Then she says she's going to enter hemorrhoids on the patient's chart.
I'm going to mark hemorrhoids, even though we don't see them, and probably won't.
Even though we don't see them and probably won't.
I'm just going to take a shot in the dark.
This patient, after waking up and hearing the phone recording, sued the doctors. The gastroenterologist was ultimately dismissed from the case, but the anesthesiologist and her practice were ordered to pay $500,000 in damages. Again, This is just one incident and an egregious.
Okay, so not to make everybody super depressed, but get this back up here. But I highly recommend if you have a spare, free hour or something to finish listening to this podcast here. It's on Freakonomics. It's free. This Compassiononomics, but really, what this is, it's not. And they go on to comment on this. These people, they're doctors, right? They care, but it's just this. They've had such a loss of kind of who they are, and this depersonalization, etc., which manifested in this way. And I'm sure many of us have seen similar types of circumstances. So just to say that burnout can manifest in a number of different ways, and unfortunately, this is one of the ways that it can happen. Just to think that, hey, I just got to get to the next step, and things get better. That's, unfortunately not true either. So as you can see here, this level of burnout, it kind of goes up and down as you go through your career. But even when you're done with residency, grass is a little bit greener, but it's not that green. So 40% of early career physicians do complain of burnout. So, what you need to know is this is something that's not going to go away, even when you do reach that next level. And just specifically, how does this relate to orthopedics? And this is something that's a little tricky to figure out. This is kind of the best thing I found. This is this meta-analysis done in China, where they looked at all these different studies, and basically about 30% of orthopedic surgeons are burned out. And this is kind of in contrast to these other numbers that we see. If you just Google this, there's all this stuff, Medscape, whatever, where they have these different statistics. I have no idea where they come from, but you could see here just for relative numbers, apparently we're right in the thick of it. I remember as a trainee, I was always under the impression that, hey, ortho's sweet, we never get burned out, but that does not seem to be the case. Okay, so now, is this being addressed at all? And I would say yes. Fortunately, it's being at least published. So just in piecing this talk together, I thought this was pretty interesting. So orthopedic surgery burnout is just a simple PubMed search. And if you see here, that little chart shows this kind of exponential growth in looking at burnout. So at least awareness is getting spread a little bit. I don't think any talk that relates even a little bit to wellness can't discuss COVID. And just a few things, and this is really not ortho specific, but excuse me, just in regards to the general population. So the patients we see, the amount of anxiety that was self-reported has doubled, as one would, not surprised to hear. And this thing of significant distress, almost 300 times greater since the development of COVID. And in medical professionals, this anxiety is just extremely high. So 45% of us reporting anxiety, depression almost 40%, and this correlative increased substance use as well as suicide risk. And it doesn't seem like this is going away. So being resilient is really going to be an important factor going forward, and now and likely forever. So that was more the kind of diagnostic kind of portion of the talk, letting you know the lay of the land. But what can we do? So once again, I don't want to say that this is all directed. There's a lot the institution needs to do and can do to help us. And these, I think, are things that we should focus on. And I know a lot of us are on various committees, but to consistently reinforce these concepts. And I know what typically happens is things get a little bit of steam and they kind of fall by the wayside. It's the natural kind of ebb and flow. But by consistently reporting these things, hopefully we have a better chance of making some change. So these 5 things. So number 1, focus on efficiency and support in the practice environment. I think us as orthopedic surgeons, our number 1 gripe is turnover time. Next is develop leaders that really kind of help. And I think in our department, we do have a few of those. We're very fortunate. Optimize physician career fit. And often that relates to something that they call working to the highest level of your license. So as a surgeon, you don't want to be filling out a lot of paperwork to get somebody a walker. So that's kind of not ideal, and those kind of things do affect wellness. Having a good work environment, and lastly, making this work-life kind of balance integrated. So very challenging things, easy to say, but very difficult to accomplish and do. So we'll spend a few minutes here kind of on the individual aspects and some things I was hoping, some of us could take home and do now or in the near future to start making these first little steps. So this is interesting. This is actually off of a grave of an Athenian doctor. So these are the duties of a physician. First, to heal his mind and to give help to himself before giving it to anyone else. So really, you have to take care of yourself before you can take care of other people. And then this other little quote by Dr. Osler here. So the young doctor should look about early for an avocation, a pastime that will take him away from patients, pills, and potions. So really, he's saying get a hobby. And I think that's important to that work-life balance part. So there's tons of steps in wellness, and I think that's and resilience, addressing burnout, and that's what makes this such a kind of challenging beast, even in the scope of piecing this talk together, coming up with like a coherent, logical sequence. What was difficult because there are so many different directions this can take. So things that I think we can all agree are important: stress reduction, taking care of yourself, meditation's helpful, making more money, and that's from both individual as well as a sense of getting what you feel that you're worth, having consistency in your schedule. All these very challenging things, but also very important in the wellness arena. So what I would propose, at least initially, as these things are kind of picking up, is just baby steps. And for the faculty on this call, one of the things I wanted to mention was that going forward, every month at our faculty meeting, I'll be presenting one little thing or one little aspect that's available to us in order to help improve our wellness. And for the residents, once again, please let me know, and medical students, anybody else, please let me know what other areas and avenues you would be interested in. So one of the things that they've started doing in the emergency department here is this, I forgot what the actual term is. I think they're going to pay for a service, but basically what this is, it's giving shout outs to your fellow team members who did a good job. Like, oh, hey, nice innovation, or, that was code that was really well done. And I would say that we could propose something like this amongst ourselves. So maybe at the end of a day in the operating room, tell each person, one thing they did well. And if you don't feel like you're ready for that big step, on your bicycle ride home, on your drive home from work, just mentally go through, spend 5 minutes, 3 things that went well. And these kind of little positive mind step exercises have been found to actually improve one's wellness and decrease burnout. And for me, this is just a little example from the other day. Instead of thinking about, oh, here's another distal radius fracture, here's another CMC arthroplasty, I was doing a trapeziectomy, got the bone out in one piece. And while that may seem kind of silly to a lot of people, for me, I was like, this is great. I have not done this before. This has been a goal of mine. And to have that accomplishment there really made what was sometimes what was kind of a challenging day that much more beneficial or positive. A few slides on this, and this is both from Dr. Gundel a little bit, but also because the ACGME is going to be asking and wanting to address this, and that's to kind of minimize these effects of sleep deprivation. And I want to give a little shout out to Dr. Mukundan. She is one of the sleep medicine physicians here at OHSU, and she gives a wonderful talk about this. And if there's interest, it'd be great to have her as a speaker for our department. I think both faculty and residents could really learn from her. But in regards to sleep and sleep hygiene, I think the key is you need to make it a priority. So there really shouldn't be any specific rotations, etc., where you feel you are getting inadequate sleep. Sure, you take call, we all take call, etc., but if there is a consistency or a consistent theme or rotation, which is a problem, of course, please let Dr. Gundel, Dr. Fries, Dr. myself know about this, so we can hopefully come up with some solutions. But just a couple of quick slides to show what is the benefit of sleeping. So this is a pretty interesting study. So what this was is they taught various residents this complicated kind of tapping motion, and that what they would allow them to do is to either do the tapping motions and then practice them, retest them, or to actually just go to sleep. So here is, in this example here, so this is residents who are well rested. So they're taught this tapping motion, and then they get to practice it. They practice it again, and then they sleep, and this is where they're at. So, and then this next slide, this is post-call, taught the tapping motion, they do it again, they get to practice one more time, and then they sleep, and then this is where they're at. And though finally, this is the most interesting one, right? So they're taught this tapping motion, they don't practice, you go to bed, you get your rest, and these, the second test and the retest were statistically significantly more efficient and better just with that sleep. So it wasn't more practice that made them better, it was being well rested. And the other thing is to consider, especially if you're taking call, etc., have a busy weekend of operating, is something called strategic naps. So these are less than, if you're about to be on call, having a little nap beforehand, or some of these other little things you could try. So if every couple of hours you're able to sneak in a 15-minute nap, it actually improves your performance for the next couple of hours. So having that be kind of a priority is important, and also having the ability to realize that your time at night is often spent better trying to sleep than to study. And the reason that is the retention is much higher if you're well rested, or if you even give your brain that little bit extra rest. And while not recommended, this one can take these 2-hour naps every 12 hours and maintain your alertness for a pretty significant period of time, so about 80 hours. And these kind of numbers were elicited from studies done on soldiers in Afghanistan, etc., who had to be up for really long periods of time and had to take these cognitive tests intermittently to see their performance. And this was found to be something that was helpful. But don't take this in the wrong way. You know, I don't want to say that, oh, Dr. Nazir said that I should just be sleeping all the time and then you doing this to study for the OITE. That doesn't work. So sleep is an important adjunct to learning, not one is better or more, or one can replace the other. Kind of lastly here, there's a few things I wanted to mention that I thought were very important and available, but I did not know they existed. So the university has this pretty well developed peer support program, and what this is it can put you together with somebody else who is in a similar type of position in their career, whether you're a resident or attending, etc., and to discuss cases or challenges you've had in a confidential fashion. And anecdotally, I think a lot of us do this anyways. You know, you meet up with your co-residents, your fellow medical students, and talk about some of the things you face. You know, you chat with one of your other, people on your foot and ankle team or whatever to see how cases have gone, ups and downs of practice, etc. But to know this kind of formal system does exist. So just a shout out to Dr. Hayden and Dr. Working. They've been trained in this, and Dr. Hayden, when I talked to him about this, said that it's really underutilized. So if you feel the need, this does exist, and I think it's a really good program that we have here. And it just really shows too that to have solidarity really helps one get through the challenging circumstances and times. So another thing of note is here at OHSU, we have access as a kind of medical student up through attending to free unlimited coaching and counseling. So a couple unique aspects to this. So this is not documented in Epic, and in today's environment, all of this can be done virtually. So you can have appointments by Dr. I, etc., that are done, that are scheduled, and you don't have to show up anywhere. You know, you can keep it as low key and confidential as you like. And they do have prescribing abilities too. So if there's, a need for any kind of pharmacologic intervention, that's available. And a question I had when I was asking about these things is what's actually reported? They have to have some kind of documentation. And in talking to them, the recordings are there, but they're appropriately and purposely vague. So if someone does attempt to elicit these records, for whatever strange circumstances may arise, you could rest pretty easy that your data and your counseling is being protected in the best possible way. And just in regards to that, so a number of states, when you do apply for licensure, there is a number of questions they ask. Have you had medical problems, blah, blah, blah. I don't know about some of the specifics of many states, but some of them do ask if have you been under the care of a psychiatrist, psychologist, etc. That seems to be fortunately going by the wayside. So if anything, that is a plug. If you feel like you need help, reach out. It's free, and these resources are available to us. One little thing, though, disability insurance is still old school. These people, these underwriters who do these things, they are still in the realm of, having these, they'll ask for these records, etc. So I guess just being aware of that, but I really, everyone's situation's unique once again, but this shouldn't be a deterrent to anyone seeking help if you feel that it can benefit you. And this is my official ask. Now they have a lot of people to call for funding for safety meetings when the world opens up again. So, some days you just want to be a crab and get out there and just kind of let loose. So please, please. Otherwise, I'm sure somebody will foot the bill. I guess I'm happy to as required. Just a couple of resources here. I did want to leave everybody with a few extra minutes here so you can kind of digest some of this information as we wrap up. So a couple of recommended things to look at. So this podcast, just Google it. It's really interesting. It's much more uplifting than that short tidbit that I gave. This Atul Gawande, I'm sure many of us know, that surgeon in New York, that he gives this talk, How We Heal Medicine. It's his TED talk, really interesting, and I think really pertains to any of us who are healthcare providers. And there's this little app. There's tons of these wellness apps now, and there's a smattering of them to choose from. One of them I liked is this What's Up, not WhatsApp, a little bit different. So What's Up, and it just has some little resources in there. These little kind of meditation things you could sneak into your day here and there. So just some things to consider. A lot of these things aren't for everyone, but just to know that they're out there. Just briefly, so this is a lifelong kind of thing, and hopefully, if there's interest, this is one of the first little steps that we're going to take, and hopefully enhancing the wellness in a department. Try to do your little positive thoughts either as a group or on your way home, and then they talk about these SMART goals, or these little goals that you could do that are somewhat reachable and something that you can start doing right away. So I'm sure many of you have heard, like, floss your teeth every day, or try to exercise for 15 minutes a day. And these are sometimes when you set these real lofty goals, they're really difficult to achieve, and that decreases, the ability to stick with it. So these SMART goals, measurable, where you're accountable, and a timely kind of sense, I think could be a good way to start. And then always emphasizing the importance of taking time away to decompress and taking what I call a real vacation. And it took me, 5 years in practice before I realized what this was. And what a real vacation is where you just leave your email behind, put your, thing on which says that you're not going to be answering things, leave your beeper at home, etc. Because if you allow yourself, this work will take up 100% of your life, and in an inefficient manner as well. If you're just checking your email 10 times a day, it's really not good for your wellness, and it doesn't help. It's not as helpful as you think it is. And anecdotally, the way I realized this is I used to, even when I was on vacation, always check my email once a day, and then I went to Cuba for 10 days, and I didn't have easy access to internet, and I felt disconnected from the world, and it was great. And when I came back, what I realized is nothing happened. Everything was just as I left it, except I was better rested. And I don't think anybody needs to take such an extreme measure, but just when you're off, be off and kind of be free and let your kind of self be restored. And if there are any questions, I'd be happy to try to answer them. I'm not sure if I have the answers for you. Once again, please, please, honest evaluations about this. If this is something you think, oh, we get enough of this from another avenue, I'd be happy to talk to everyone about the latest scapholunate ligament reconstruction. I think that's actually easier for me, but probably maybe not as interesting to many of you. And lastly, because the worst type of wellness is forced wellness, so that's the last thing I want to do for everyone here. So I think that's all I got. Let's see here. I guess I can answer any questions if there are any. Otherwise, hopefully we're gonna have 10 extra minutes to go here and just go and have a cup of tea or a cup of coffee and just reflect a little bit. Okay, let's see. That is okay. So I just keep staring at these names for a minute or two here. Oh yes, you're welcome. Thank you very much.
Omar, did you talk about the Spark program and all the different aspects in addition to the pairing person?
Andrea, I did not. So Andrea brings up something very great, the Spark program, and it's another wellness initiative that the university has. The details escape me off the top of my head, but I will plan on, I can kind of put together a little list of everything that's available. But the other thing with some of this stuff, I think going forward, is that if I kind of give you an information dump, I feel that, in a week everyone forgets. It may be more valuable to just have little tidbits going forward. And that's definitely an excellent one, Andrea, that I hopefully can share with everyone in the future as well. Okay. Very good. Well, everyone have a good day. Hopefully we'll see you all soon.
Thank you.